Hi, everyone. Welcome to a special episode of a ParentingU Extra Credit. I'm Stephanie, and I'm here with Dr. Callie Broussard, pediatric infectious diseases expert with Our Lady of Lourdes Children's Health. Hi, Dr. Broussard. Welcome.
Hey.
We are here because there's an important thing we wanted to talk about, and that's measles. A lot of parents are hearing about a measles outbreak happening near us. You have extensive experience in this area, so we wanted to talk with you about what's happening, what we can do to protect our kids, and where we go from here related to measles. So could you tell me a little bit about what's going on with the measles outbreak and what we should know?
Yeah. So currently in West Texas, around the Lubbock area, and in the eastern side of New Mexico, there's a measles outbreak. And measles, which was previously, a eradicated disease here in the United States, is making a comeback. It's having its moment. It's so hot right now. There's about 300 cases of measles in mostly unvaccinated patients or children specifically in this area of the United States. And actually about 95% of the measles cases currently are unvaccinated, and 75% of the cases are children, so patients less than 18 years old. So primarily a disease of children and primarily a disease of the unvaccinated.
Why is it so impactful to kids? Is it because of their vaccination status? Is it because of their immune systems? Why is it impacting kids so greatly?
It's because of their vaccination status. So older adults, so those born before 1957, have what's called presumptive immunity. More than likely, they've actually been infected if they were, they're that wise and were born that long ago. Other folks who were born in the 60s up until the 90s most likely were vaccinated. There was actually some big measles outbreaks in 89 to 91. So there was a big drive for measles vaccination in the early 90s. And so the majority of folks over age 18 are going to be vaccinated against measles. But then young children normally would get their measles vaccine at 1 year old and then again at their 4th birthday, so before they're entering kindergarten. But over the last several years, there's been an uptick in vaccine hesitancy. So folks just are becoming more distrusting of vaccines and more distrusting of healthcare in general. And so vaccination rates have really declined to what's called below herd immunity levels. So what's herd immunity? Herd immunity means you have a person who is either unable to be vaccinated for one reason or another, or too young to be vaccinated, and they are protected by a herd of vaccinated people. And so the herd immunity rates, or the rates of vaccinations needed for herd immunity, is about 95% of the general population. And currently we're well below that. And so this disease, measles, is pretty infectious and pretty easy at spreading between unvaccinated folks. And so it's doing just that.
Well, and tell me a little bit about the short-term and long-term effects of measles. I think a lot of people hear the word measles and they think, oh, a couple of red spots, but tell me what this really means.
So measles is more than just a rash. It is high fevers for several days. The children, and I say children because it's mostly children getting it, are absolutely miserable. They do not feel good. They are laid up in bed, not wanting to eat and drink, and they've got cough, congestion, runny nose. They've got pink eye as well. And then with these fevers on top of those respiratory symptoms, and then about 4 or 5 days into it, they get a rash. And you're like, oh, goodness. Rashes always scare us and scare the parents more than they bother the child. Really, the rash doesn't itch or anything, but it's not pretty. So they've got a rash that starts at their head, moves its way down, and then the fevers continue. So you're thinking, oh, the rash is here and they're going to get better. No, they're still sick. They still continue to fever for several days after that. And they're infectious. Before they've got the rash, they're able to spread the illness days after they've got the rash as well. So it's going to spread to anyone they've encountered even before they started to show symptoms, and then for days later. Kids with measles not only have the measles infection, but a lot of them will get secondary bacterial complications. So otitis media or ear infections is a common thing that happens with and right after measles. Pneumonia, not only bacterial pneumonia, but measles itself can cause a pneumonia. So a viral pneumonia that we don't necessarily have an antiviral treatment for. And then they can get bacterial pneumonias after that. About 20% of patients with measles will get admitted to a hospital for some kind of care, whether they need respiratory support or they need fluid. 1 in 1,000 kids with measles will get acute encephalitis. So what's encephalitis? That's a brain infection, brain inflammation. They'll get that. And then 1 in 1,000 kids or folks with measles will die. So it's got a 1 in 1,000 mortality rate, which is very frightening. I mean, we're at 300 cases in the Texas outbreak, and one child has already died, and two people total have died. So that's a little bit higher than that 1 in 1,000 mortality rate.
And one is too many.
Agreed. Very much so.
You have treated measles and you have seen patients with measles. Can you tell us the real impact of what this infection does?
So in my infectious diseases fellowship in Columbus, Ohio, a couple years ago, there was a measles outbreak within a largely unvaccinated Somali community. So there's a big group of Somali folks there, and they all attend a lot of the same schools, the same daycares, the same churches, and many of their children were unvaccinated against the measles. They had not received the MMR vaccine. And so when one would get it, it would spread to many folks within their daycare. And those kids would come into our hospital. They'd visit probably a couple times before we were able to figure out it was measles, because there were a lot. This was actually during the COVID era. So they had cough, congestion, runny nose, and a fever. And we're like, well, it could be anything, right? All the other viruses that were going on. And so it's not until you have that suspicion of, is this measles, or here comes the rash, that you start doing the testing. And so those kids just really didn't look well. Several kids were admitted and were being evaluated for other hyperinflammatory syndromes, getting lots of blood work and different infusions to try and treat those things. We had some of these kids were getting echocardiograms or heart ultrasounds to make sure that wasn't being affected. And they just really didn't look well. They didn't feel well. They were just uncomfortable. You can kind of walk into the room and they're just screaming their head off. So they don't want to be messed with. And then we didn't have a treatment for them. We just had supportive care. So fluids and oxygen if they needed it, Tylenol, Motrin for their pains and fevers. And then it is recommended that you give vitamin A to decrease the morbidity. So the overall badness of measles, it is recommended to treat with vitamin A, but it's not actually an antiviral. It's not a specific treatment for measles. And so it doesn't really make a huge difference in the immediate giving vitamin A for those kids with measles. We kind of just had to let it run its course. We made the diagnosis and supported them till they were feeling better, and then had to work to vaccinate those around them, and then also kind of track and figure out everyone they had exposed within our urgent cares and our ERs and the waiting rooms and stuff like that.
Yeah, it's a big one. How can we protect ourselves? You mentioned, a lot of people in Louisiana work in Texas, come back. How can we as parents protect our kids? What can we do about this?
So as an adult, knowing your vaccine status, knowing that you were vaccinated against MMR, you can go to your local health unit to get your vaccine record. If you're not quite sure, if you have the means and the ability, you could actually get a measles titer if you're so curious. but more than likely you were probably immunized in terms of adults. Most of the vaccine rates used to be pretty good. To protect your kids, they can get their measles, their MMR vaccine at 12 months of age. They can get their second one at 4 years old. The first measles MMR vaccine dose that they receive is about 93% protective against measles infection. So a single dose means you're probably not going to catch measles if you get exposed. The second dose is then 97% effective. So they're really, really unlikely to catch measles if you've got 2 doses of the vaccine. Now, if you have no doses of the vaccine at all, you're 90% likely to catch measles if you're exposed. So that's how infectious this virus is. It will infect 9 out of 10 people who are unimmunized against it. It truly is just that infectious. And unlike some of the other illnesses we talk about, some of the other infections we talk about, measles is spread through aerosolized droplets. And so those particles, those aerosolized particles, can be present in a room 2 hours after a person infected with measles has left. And so they just came into the waiting room at the urgent care you were in, and you were bringing your 13-month-old who just hadn't made it to their 1-year visit yet. They hadn't made it to their visit with their PCP. And you're there because they had a cut, because it's summertime, and you're getting it taken care of. And then 10 days later, that kid starts running a fever, and they've got cough, congestion, runny nose, and it could definitely be measles. So being up to date with vaccines as soon as you can. There are some folks who are immunocompromised who can't receive live vaccines, which is what the MMR vaccine is. There are some folks who are too young. So kids less than 1 can't get it unless there's an outbreak. Technically, kids 6 months to 12 months can get a dose in outbreak situations. But, 6-month-old babies and younger are kind of at the mercy of us all to protect them. So do our best to improve herd immunity and keep everyone around you safe.
Well, thank you, Dr. Broussard, for this really interesting and important update. For more information, I know you can visit all of our social channels or our website. Thanks again.